Hi there, it's Lorelei. Welcome back to my channel with up-to-date news and resourceful information on mental health. If you are new to my channel and you find the videos helpful, don't forget to hit the like button down below. Today I would like to share with you a slide presentation on mental health. So let's get started. So what exactly is mental health? Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. The World Health Organization stressed that mental health is more than just the absence of mental disorders or disabilities. Peak mental health is about not only avoiding active conditions, but also looking after ongoing wellness and happiness. In the United States, the National Alliance on Mental Illness estimate that almost 1 in 5 adults experience mental health problems each year. Risk factors for mental health conditions. Everyone has some risk of developing a mental health disorder, no matter their age, sex, income, or ethnicity. Social and financial circumstances, biological factors, and lifestyle choices can all shape a person's mental health. The following factors may contribute to mental health disruptions: continuous social and economic pressure, having limited financial means, or belonging to a marginalized or persecuted ethnic group can increase the risk of mental health disorders. Biological factors. Genetic family history can increase the likelihood of mental health conditions, as certain genes and gene variants put a person at higher risk. Continuous social and economic pressure. Researchers have also explained the difference in the availability and quality of mental health treatment for certain groups in terms of modifiable factors, which can change over time, and non-modifiable factors, which are permanent. Modifiable factors are socioeconomic conditions, such as whether work is available in the local area, occupation, a person's level of social involvement, education, housing quality. Non-modifiable factors are gender, age, and ethnicity. Common mental health disorders. Anxiety disorders. According to the Anxiety and Depression Association of America, anxiety disorders are the most common type of mental illness. People with these conditions have severe fear or anxiety, which relates to certain objects or situations. Most people with an anxiety disorder will try to avoid exposure to whatever triggers their anxiety. Panic disorders. People with a panic disorder experience regular panic attacks, which involve sudden, overwhelming terror or a sense of imminent disaster and death. Phobias. There are 3 different types of phobias. Simple phobia. These might involve a disproportionate fear of specific objects, scenarios, or animals. Social phobia. Sometimes known as social anxiety, this is a fear of being subject to the judgment of others. Therefore, they restrict their exposure to social environments. Agoraphobia, such as being in an elevator or moving train. This term refers to fear of situations in which getting away may be difficult. Many people misunderstand this phobia as a fear of being outside. Obsessive compulsive disorder, or OCD. People with OCD have obsessions and compulsions. They experience constant stressful thoughts and a powerful urge to perform repetitive acts such as hand washing. Post-traumatic stress disorder, or PTSD. PTSD can occur after a person experiences or witnesses a deeply stressful or traumatic event. During this type of event, the person thinks that their life or other people's lives are in danger. They may feel afraid or that they have no control over what is happening. Mood disorders. People with these conditions have significant changes in mood, generally involving either mania, which is a period of high energy and elation, or depression. Examples of mood disorders are major depression. An individual with major depression experiences a constant low mood and loses interest in activities and events that they previously enjoyed. With unusual changes in their mood, energy levels of activity, they can feel prolonged periods of sadness or extreme sadness. Bipolar disorder. A person with bipolar disorder experiences unusual changes in their mood, energy levels of activity, and ability to continue with daily life. Periods of high mood are known as manic phases, while depressive phases bring on low mood. Seasonal affective disorder. Reduced daylight during the fall, winter, and early spring months trigger this type of major depression. It is most common in countries far from the equator. Schizophrenia disorders. Mental health authorities are still trying to determine whether schizophrenia is a single disorder or a group of related illnesses. It is a highly complex condition. Signs of schizophrenia typically develop between the ages of 16 and 30 years. The individual will have thoughts that appear fragmented, and they may also find it hard to process information. Schizophrenia has negative and positive symptoms. Positive symptoms include delusions, thought disorders, and hallucinations. Negative symptoms include withdrawal, lack of motivation, and flat or inappropriate mood. There are early signs of mental illness. There is no physical test or scan that reliably indicates whether a person has developed a mental illness. However, people should look out for the following as possible signs of mental health disorder: withdrawing from friends, family, and colleagues, avoiding activities that they would normally enjoy, sleeping too much or too little, eating too much or too little, feeling hopeless, having consistently low energy, displaying negative emotions, using mood-altering substances, including alcohol and nicotine, more frequently, thinking of causing physical harm to themselves or others. Treatment for mental health problems. There are various methods for managing mental health problems. Treatment is highly individual, and what works for one person may not work for another. The individual needs to work closely with a doctor who can help them identify their needs and provide them with suitable treatment. Treatments can include psychotherapy, which is a general term for treating mental health problems by talking with a psychiatrist, a psychologist, or other mental health provider. During psychotherapy, you learn about your condition and your moods, your feelings, thoughts, and behaviors. Cognitive behavioral therapy is a type of psychotherapy in which negative patterns of thought about the self and the world are challenged in order to alter unwanted behavior patterns or treat mood disorders such as depression. Exposure therapy is a technique in behavior therapy to treat anxiety disorders. It involves exposing the patient to the anxiety source or its context without the intention to cause any danger. Doing so is thought to help them overcome their anxiety or distress. Dialectical behavior therapy is an evidence-based psychotherapy that began with efforts to treat borderline personality disorder. There is evidence that DBT can be useful in treating mood disorders, suicide ideation, and for change in behavioral patterns such as self-harm and substance use. Just as a side note, psychiatrists, psychologists, psychotherapists, and some primary care physicians can carry out these types of different treatments and therapies. Medication. Some people take prescribed medications such as antidepressants, antipsychotics, and anxiolytic drugs. Although these cannot cure mental disorders, some medications can improve symptoms and help a person resume social interaction and a normal routine while they work on their mental health. Some of these medications work by boosting the body's absorption of feel-good chemicals, such as serotonin from the brain. Other drugs either boost the overall levels of these chemicals or prevent their degradation or destruction. Self-help. A person coping with mental health difficulties will usually need to make changes to their lifestyle to facilitate wellness. Such changes might include reducing alcohol intake, sleeping more, and eating a balanced, nutritious diet. People may need to take time away from work or resolve issues with personal relationships that may be causing damage to their mental health. People with conditions such as anxiety or depressive disorder may benefit from relaxation techniques, which include deep breathing, meditation, and mindfulness. Having a support network, whether via self-help groups or close friends and family, can also be essential to recovery from mental illness. I do hope you found this presentation on mental health useful and informative. If there's a particular piece of news or a video you would like to comment on, please feel free to do so on my channel. As always, if you know of anyone who is going through a difficult time and is in need of help or support, I am here for them. Until next time, thanks for watching and take care.